Sanjay Gupta remains with us. We're joined in New York by Dr. Mehmet Oz, health expert for the Oprah Winfrey Show, a New York Times best-selling author and professor as well at Columbia University. And in Washington, Dr. Bob Arnott, also known as Dr. Danger, former network correspondent, author of Your Survival. Dr. Oz, we would seem 9 minutes into this program, we ought to get a definition. What is swine flu?
Well, swine flu occurs when a virus that lives normally on pigs somehow mutates and changes and becomes available to the humans that take care of those pigs. So we believe that sometime in very early April, maybe the end of March, in a small town in Mexico, some of these viruses, which again very commonly live on pigs, jumped into humans, and they mutated in a way that scares us. Because now that we've been able to look at this virus carefully, it seems to have an ability to drill into human cells that's different than other viruses that we have examined in the past. And once, of course, these viruses get into human cells, they replicate themselves, they trick our bodies into allowing them to replicate, and they explode and cause the clinical syndrome that we see.
Dr. Arnott, can we expect that since the summer months are coming, it'll die down a lot because these flus usually thrive in winter, and that by next fall, if it comes back, it'll be part of the vaccine package?
Larry, it's a very smart take. That is, this is the end of the flu season now, and you would expect that it would actually die off here in the U.S. They're at the critical threshold now at the Centers for Disease Control whether or not to incorporate this into next year's vaccine. Now, the key thing is Mexico. The question is, why do you have so many sick kids there? And this is something that attacks young as opposed to old. And why so many deaths? One interesting answer is that in Mexico, they're looking actually for the virus just in hospitals. There could be thousands or tens of thousands of others who've been affected. So right now, nobody knows the extent of this. Surveillance over the next week or two will tell us whether this is just going to be a short scare or this is something we should all be very worried about. But I think you're dead right. It's next fall we should start to worry about it here in the U.S. if it continues.
Dr. Gupta, I know you're part of the news media, but this question is fair. Is there a danger in possible over-reporting this?
I think so, but I think the critical thing here is responsible reporting of this. Some context, first of all. We have around 150 deaths, as Ted Rowlands mentioned, and we don't know out of how many that is, as Dr. Bob was sort of referring to. That could be out of thousands and thousands of people who had mild illness. That's important, because this could have a very low fatality rate. Another piece of context, around 36,000 people die every year in the United States on average from seasonal flu. So 36,000, we're talking about 150 or so in Mexico. So there's some context there. Having said that, this is an unusual virus. We've never seen a virus like this particular virus in the world. And it is spreading around the world in ways that raise some red flags for the public health officials. It also seems to be affecting people in their prime, as opposed to the elderly or the very young, which seems to be the targets of seasonal flu. So there's some concern there, but I think responsible reporting is the key here, Larry.
Dr. Oz, should the United States facilities be sending Tamiflu, a very effective drug against viruses and flu, to Mexico?
I think we can share it with Mexico, but again, most of the time these viruses, and just to echo what's been said earlier, are affecting many, many more people than we're actually identifying. So the question then becomes, how do you get the flu treatment to the right people in time? Ideally, you'd be able to get the treatments to folks within 48 hours of diagnosis. We've got about 50 million vials available in this country. A quarter of those have not been released to be spread out as required. But I think for most folks, that's not going to be the ideal way of treating this virus. It's going to be a self-limited case, as it has so far been in this country. I do think for more severe cases, the very young, the very old, who traditionally have been have fallen from these viral illnesses, it makes a lot of sense. But I am not sure we're going to reach the level of pandemic that the 1918 Spanish influenza incurred on humanity, where it took about 50 million lives. That's the fear that many are worried about. And in that case, we'd have to use these Tamiflu-type medications for hospital workers and people who are going to be forced to take care of the ill and stay healthy enough to keep taking care of them.
Dr. Arnott, is there any danger in eating pork?
No, there really isn't any danger in eating pork. Interesting, though, Larry, in terms of Tamiflu, that for this to work, you have to take it in the first 24 hours, the CDC was just telling me. And if you don't take it just as your fever starts to spike, it's probably not going to work. There is a recommendation today that if you're taking care of somebody with a flu, you might take this. And in terms of sharing it with Mexico, think of those poor hospital workers there that we just heard Sanjay talk about, who don't have Tamiflu or Relenza and are taking care of patients that could badly infect them.